Hi, welcome to DrSecrets.com. I'm DR, and today we're going to talk about
how doctors measure blood pressure. When you're in the office sitting down getting your blood pressure taken by your physician, sometimes it can seem like we're just doing some voodoo or something wishy-washy. So in this section, what I'll do is explain to you what it is that we're doing, and that the numbers that we're coming up with, we don't just come up out of thin air. So in this little cartoon here, we have a gentleman sitting down having his blood pressure taken. No, what we're talking about here is actually manual blood pressure assessment, because it can also be done by machines in a lot of cases, especially in hospitals. But if you get one of the old-fashioned type assessments with what we call a sphygmomanometer, typically what you'll notice is that there's a tube coming off of it with the air bladder in it, and then there's a cuff that wraps around your arm, and then the doctor or nurse will also use a stethoscope and slide it under the edge of your arm. So basically what they're doing is, if you feel your arm in the inner aspect of your elbow here, you can feel a pulse bounding in that area. That's a direct connection to an artery feeding off of your heart during each contraction or clap. So what we're really doing is by putting this cuff around the arm, the air bladder here in this lady's hand, we squeeze that, and that pushes air into the bladder, making it more and more turgid, or squeezing your arm tighter and tighter. Now, some people will complain at the end of squeezing this bulb that we tighten it too tight. The reason that we have to tighten it that tight is what you're trying to do is overcome the pressure that's running through the artery with each clap. So in order for us to assess the blood pressure, we actually have to stop the flow of blood going through that artery. So we have to inflate the cuff to a pressure that is beyond the pressure of the pulse head itself. And that's why sometimes it hurts. That's the other reason also why, if we leave the cuff on for too long, your hand will start to go numb or change color or get numb or tingly. That's because we're cutting off the blood flow going down to your fingers and hand. But hopefully, if it's done right, we won't leave the cuff on that long for your hand to turn blue. Alright, so getting back to our little diagram here. So this lady here, she's the doctor or nurse, and she's inflating up the cuff. She then takes the end of her stethoscope and places it over that pulse that I was talking about before in the inner part of your arm. So you slide that under the edge there. Now what you're listening for is, once you overshoot the blood pressure, when you'll see that she'll turn a little valve open on this on the blood pressure cuff, and slowly release some of that pressure off the cuff. And initially when she's listening, she'll just hear silence, and then once you reach the systolic pressure, the top number of your blood pressure reading, the systolic is basically just when the heart is clapped, then you start to hear the pulse. So at that point, you mark that number down, and I forgot one thing here. On the wall, there'll usually be a dial with a little, it looks almost like a clock missing one arm. So and it's got a bunch of numbers on it. So that's how we can tell where you're at. So once we start hearing the pulse going through again, we know that that's the top number, or the systolic, because your artery, the pressure in it has superseded or overcome the pressure inside the cuff. So we make a mark of that number. Then as we continue to listen, we continue releasing more pressure off the valve. And then eventually what happens is, when you get to the diastolic, which is when the heart is relaxed, suddenly you don't hear the pulse anymore. So this marker here is the systolic, and this marker here is the diastolic. Very, very simple. And typically what we're looking for normal is 140/90 or less if you're the average person. If you have some kind of medical condition, then we're looking to keep it a little bit lower. So say this gentleman here was diabetic, then we'd be aiming for something like 130/80 or less. And if you had some kind of heart failure or kidney disease, then we'd be looking to keep it even lower than that. So that, ladies and gentlemen, is how we measure blood pressure the old-fashioned way. Very simple. Thank you for watching, and stay well.